Hello, and thank you for joining this American Academy of Pediatrics webinar, Talking to and Supporting Children During a Pandemic. My name is David Schonfeld. I'm a developmental behavioral pediatrician and director of the National Center for School Crisis and Bereavement at Children's Hospital Los Angeles, where I am professor of clinical pediatrics at Keck School of Medicine. I am also a member of the AAP Council on Disaster Preparedness and Recovery Executive Committee. Let me start by stating I have no conflict of interest to disclose. What I would like to discuss today is to first start with some of the general principles of communication during a crisis. I'll then turn to talk about children's and adults' understanding and misunderstanding of illness, and how we can then apply that information to provide advice to parents and guardians on talking with and supporting their children. We should also recognize the role that parents and guardians can take by serving as a model for coping. And lastly, I want to emphasize the importance of remembering to take care of yourself. Let's start with general principles of communication during a crisis. Communication about a crisis should not be a source of further crisis. There are two basic reasons for public communications in the setting of a crisis: to provide reassurance or to provide information to direct people to take specific actions to decrease their risk of catching the virus or of getting seriously ill once infected, as well as to decrease the risk of spreading the virus to others. Reassuring announcements should, in fact, be reassuring and not sensitizing. And if information is provided as a call to action, you need to optimize the likelihood that people will both understand the message and respond in the desired manner. Let me give you an example of a reassuring comment in this context. The risk of serious illness in most children when infection does occur is low. An example of a message to take appropriate action might include, take these steps to prevent exposure, followed by concrete steps such as hand washing and social distancing. Another message might be, if you are concerned that you may be exposed, call this specific phone number to see if you should be tested. Warning people of potential dangers of a pandemic and telling them there may be catastrophic loss of life, but then saying that the potentially life-saving vaccines or medical countermeasures won't be ready for at least several months doesn't make a lot of sense during a pandemic. We don't need to craft messages that tell people to get scared, especially during a crisis. They can do that quite effectively on their own. Instead, we should provide basic, relevant information, but without unnecessary detail. People generally don't understand detailed medical information, especially in situations where there is a great deal of apprehension or fear, such as in the setting of a pandemic, and don't need to know it. Concentrate on what is behaviorally relevant, what they should do to minimize their risks or treat their condition. Tell people what they should be looking for, but also what they can do when they find it. Don't just tell them to recognize potential symptoms and then defer to local authorities for the rest. This might work if the pandemic only involved a small number of people whose individual questions could be handled easily by local providers, but that's not the case in pandemics. Remember, you won't be able to tell them everything, so advise people where they can go for additional accurate information. During your communications, avoid overreaching recommendations. An example of what not to say is on this slide. If you have any concerns that you or your children may have been exposed or are ill, seek evaluation from your doctor or local emergency room. That would be an overreaching comment. It's often said that one voice, one message is what we need in a pandemic, and that is a good goal in a crisis setting. But many voices with conflicting messages likely to be what you will experience. In my experience in this area, misinformation often travels faster than accurate information, and it's usually more interesting and compelling. Those who are ill-informed often come up with explanations that are convincing to people that are ill-informed. Those that are highly educated, such as healthcare providers, too often provide explanations that are convincing mainly to people that are well-educated, who are often least in need of the education. Physicians need instead to communicate in a way that is understood broadly by patients and families, and they should aim to concentrate on conveying the most important information. Don't try and get across every caveat and finely nuanced point. Honestly, many people don't know what caveat or nuance means. Use instead language that is direct and simple to understand, and avoid jargon. When meeting with pediatric trainees, I often suggest that if you prepare an explanation that you think a 5-year-old will understand, chances are 50% of adults will understand it. And if you can explain something simply, why wouldn't you start with that explanation with everyone? People will decide what information is correct mainly by whom they trust, rather than based on the accuracy or completeness of the information. Most people honestly can't tell what information is more accurate, and if they could, they probably wouldn't need explanations about the illness. They often base trust on interpersonal factors, such as empathy, connectedness, genuineness, etc. Give careful consideration to the characteristics of the spokesperson in a pandemic setting. I will note, pediatricians generally do well in these areas and should present themselves as experts and potential spokespeople. We have to remember that people don't learn well when stressed, and they're going to be stressed during a crisis. And people don't explain things well when stressed, and doctors and public health officials will be stressed during a pandemic. So it's best to have some material scripted prior to the event whenever possible, or at least as the event is occurring. We want to emphasize practical information and don't assume you can rely on common sense. In my experience, common sense is often uncommon during a crisis. We should avoid using fear-based approaches to compel people to act. People need to feel a degree of risk in order to take preventive actions, but excess fear is counterproductive. It can lead to a sense of fatalism, such as prompting people to abandon risk prevention measures. A child may conclude, for example, that germs are everywhere, so eventually they're going to get it anyway, and then not take appropriate steps. It can also lead to reactance. If children find one warning to be false or exaggerated, they may discredit them all. They may think, for example, one of my school staff had COVID, but I didn't wash my hands that day in school and I'm still okay. So all of these recommendations are exaggerations, and therefore I won't believe any of them. Therefore, you need to avoid depicting risks as absolute, and instead introduce the concept of relative risk in your discussion with children. Reactive risk-taking and counterphobic behavior can actually also be seen. Children may be so scared they decide to take a risk just to prove that they'll still be okay. This is probably one of the reasons why older children experiment with risky behaviors. It's not that they believe themselves to be invulnerable, it's just that they don't want to be vulnerable. I would also be cautious about introducing other risks as a comparison in the context of a pandemic. Trying to reassure people by telling them that it could be worse, such as more people have died recently of influenza, for example, is likely to make them think it will get worse, rather than be a reassuring comment. Instead, find out about the individual's fears, concerns, or skepticism. You can't reassure people if you don't know what they're actually afraid of or concerned about. Otherwise, you usually aren't offering reassurance, but rather you're telling them why you aren't worried. And when two people each talk only from their own perspective, we call that arguing. And it isn't very effective in providing reassurance, and it isn't very satisfying for families or pediatricians. The pandemic and discussion about the impact on families may also remind children and adults of other difficulties in their lives, whether that be events in the past, ongoing challenges, or concerns about future losses or crises. These children may be particularly vulnerable in the coming weeks. We need to realize that children and adults may have limited understanding of illness and its treatment based on a number of related factors: limited information, misinformation, misinterpretations, or misconceptions. Let me start with limited information. That would be that they weren't told about it. Misinformation may be that they were told incorrect information. Misinterpretations and misconceptions means that they were told correct information, but misunderstood it, either because they got the facts wrong or they understood the facts but didn't understand an underlying concept. For example, one child that I met had a misinterpretation regarding sickle cell disease and what had happened to a peer. A child had passed out in class, and the child only understood the word passed and thought that the child had passed away. The child did not return to class and did not return to school, and it was the end of the school year. And her understanding was that the child died suddenly of sickle cell disease during lunchtime. Unfortunately, this child too had sickle cell disease. And so her misinterpretation lasted several years and led her to be concerned every time she had a painful crisis. An example of misconception in a child with sickle cell disease was an adolescent that I had worked with. He was hospitalized for dizzy spells and being worked up for transient ischemic attacks. His misunderstanding was that he finally commented to me that he was the oldest child in the sickle cell clinic at the Children's Hospital. When I asked him what he thought that meant, he said that must mean I'm going to die. I explained to him that we transferred to the adult hospital across the street when he was a year older and introduced him to another older adolescent with sickle cell disease. And at that point, he said he was feeling fine and ready to leave the hospital. So children may not get the information, they may get incorrect information, or they may misunderstand the information that they receive. So we need to figure out what is their source of misunderstanding in order to correct it. Presenting accurate information alone often does not correct pre-existing misinformation or misunderstandings. It turns out that individuals can, in some situations, hold two conflicting pieces of information as being true. I remember talking to a science teacher who thought that she could spread poison ivy from person to person. I asked her what caused poison ivy, and she said it was an irritation to the sap from a particular plant. When I asked her how that could then be spread from person to person, she said the fluid inside the lesions could cause that. And I asked her whether human beings can actually make plant sap. And she said, of course not. And I said, well, then how could it spread from the fluid that people make to another person? And she just looked at me and she said she had never considered that. Before we be too critical of science teachers, let me also say that I've talked to some pediatricians who warn their children that they might catch a cold if they go outside with a jacket, when they clearly know that a cold is caused by a virus. It appears we can hold two sources of information as true, even when they don't make sense when you think about them. So don't just provide accurate information, but try to find out what misinformation they still believe to be true and what they don't understand accurately. We need to also monitor the information provided to the general public by others to identify and then address the misinformation. But we should also ask children and adults directly to explain what they've heard and already understand, and then we'll identify their misunderstandings. I will say that even very young children can be helped to understand more about health if we help them understand it better. I was doing a project regarding an elementary school AIDS education curriculum, and I remember in a second grade class at the end of the curriculum being asked by a student about whether or not you could get AIDS from a dirty toilet seat. I explained that you could not, and he asked the question a second time, so I met with him after class and asked him what concerns he had and why I was not able to reassure him. He explained that his uncle lived with him and that his uncle had some gastrointestinal problems with diarrhea that sometimes had blood in it. That blood would get on the toilet seat on occasion, and his sister was a toddler who would play with the toilet seat and then stick her finger in her mouth. He didn't know if his uncle was HIV positive, but he questioned that if he were, and some of that blood was still wet and on the toilet seat and got into his sister's mouth while it was still wet, could that be a source of infection if his uncle was infected? I think that shows that just what they ask isn't necessarily a clear estimate of how much they understand. Kids have the capacity to understand these things quite well, but we need to take the time to make sure that they do. So let me turn now to advice for parents and guardians. I'm just going to use parents throughout to refer to parents and guardians on talking with and supporting children. To start with, adults should initiate the conversation with children. Given the current situation in the US, it's highly likely children have heard about the pandemic and have questions and concerns already. Start by asking them what they've already heard, how they're feeling about it, and what questions or concerns they have. Then provide basic information and pause and respond to their questions and concerns. Don't try to cover everything in one conversation, but keep the door open for them to ask questions as they arise. Don't pretend that everything is okay when it isn't. Children can pick up when parents and other adults are not being genuine and honest, and they'll be less likely to ask questions or seek advice. While children's adjustment is highly dependent on their parents' adjustment, children also benefit from knowing that their parents have similar or even additional concerns, and learning how their parents deal effectively with troubling or distressing feelings. We can't expect children to share their concerns when we are unwilling to do so, and we certainly can't help them learn how to cope with distress if we don't model coping techniques. Children may also pick up on concerns that are primarily those of adults, such as related to how the pandemic may impact employment or income of parents and other members of the extended family. Try to have these conversations among adults when children are not likely to overhear the discussion. If children do have financial concerns, if possible, share reassuring information that places the financial concerns in a context relevant to the child. For example, you might say, with all that is going on, it's no longer a good time to buy a new car or to plan another big vacation, but don't worry, we have enough money saved that we will be able to meet our living expenses. In some families, honestly, financial concerns were a significant issue prior to the current pandemic, and those are only exacerbated. In your discussions with children, still try to focus on what you can honestly provide for them, rather than on what you may not be able to pay for if the situation worsens. The goal is to provide appropriate reassurance, but don't give false reassurance or minimize legitimate concerns. Children may be worried about visiting older relatives and exposing them unknowingly to the virus, for example. The adults should decide among themselves what are appropriate steps to take to minimize that risk, and then explain them to children as what we've chosen to do. Don't tell children they shouldn't be worried. If they feel worried, they are worried. Instead, help them learn to deal with the uncertainty and fear. Share with them strategies to deal with distressing feelings rather than pretend they don't or shouldn't exist. Be sure to include positive or reassuring information and still present a hopeful perspective. This is not a good time to convey to children a strong criticism of the government's response to date or a candid assessment of the leadership of those in public office, unless the children are seeking advice on how to vote in an upcoming election, which would be, of course, much older children. Try instead to convey that you hope and expect the scientists and public health officials are learning how best to handle the situation, and that you anticipate your community and country will be making decisions to address the pandemic. You should explore with children different strategies of dealing with distress, discomfort, anxiety, and sadness. For children whose daycare, school, or college has closed, establish a predictable routine at home. This is important for the adults as well who are working from home. Other strategies might include reading or hobbies that promote healthy distraction, talking to others, journaling or blogging, or art and music to promote expression of feelings. Appropriate use of respectful humor is also okay. Relaxation techniques and mindfulness, which can be taught even to very young children, are an option. Self-hypnosis and guided imagery can be learned to deal with anxiety, and cognitive behavioral therapy can help children replace negative thoughts with more positive interpretations that result in improvement in both feelings and behaviors. Many of these techniques can and should be learned before the child is experiencing high levels of distress or anxiety, because many involve practice and coaching and are easier to master when you're not under stress. But the principles can be introduced and basic skills learned even now. Help children identify developmentally appropriate steps they can take personally to protect their own health and to help others. Let them pick out the soap they prefer to use to wash their hands, if you can find more than one option available. Let them provide input into their hand washing routine, such as picking what song they would like to sing. Seek their input into what they would like to do at home if school is closed. If children can contribute to the response, they're likely to feel less helpless. And finding ways to help others can also help children feel some sense of agency during a time when they're feeling powerless. Adults should try to keep informed through focused and periodic attention to a trusted media outlet or other trusted source of information, such as the websites for the Centers for Disease Control and Prevention or that of the American Academy of Pediatrics. People shouldn't, though, listen to continual coverage, even if it is available. The pandemic is going to be here for quite some time, and people will get overwhelmed and exhausted if they try to keep up with every bit of information. I advise people, if they aren't getting more reassured or learning practical information about actions you need to take, then disconnect from media, at least for a time period, and that would include television, radio, print, and social media. Advise children to also limit their amount of media exposure. This is a good time for everyone to unplug and connect instead with your family and friends. It'll allow parents to focus their attention on children's needs and provide and receive support. And lastly, I would like to emphasize the importance of professional self-care. We should appreciate what impact all of this is having on us as healthcare providers. Healthcare providers likely will have concerns about their own health or those of family member and friends. The burden of extra work demands has an impact on healthcare providers both professionally and personally. Being around people who are needy, demanding, self-centered, or distressed isn't fun or particularly satisfying. This is especially the case when you feel you are either unable or unprepared to provide assistance. But there is a lot we can do, even in the midst of an evolving pandemic. While we can acknowledge the limitations in our current knowledge, we shouldn't minimize the value of our guidance and the assistance we can provide. Just because we don't know everything doesn't mean we know nothing of value. Helping people who are in need and minimizing some of their distress can be very rewarding professionally and personally gratifying, but it's still hard work. And hopefully some of this information will help you feel more prepared to provide assistance to your patients and their families. This last slide provides some of the resources available to you. You can find the website for AAP critical updates to COVID-19, as well as the Red Book Online provides information about COVID-19 under Outbreak section. And there are articles on healthychildren.org that can be shared with families. If you have any questions regarding coronavirus disease 2019 or COVID-19, please email covid-19@aap.org. And thank you again for taking the time to view this important webinar.